Warfarin and other vitamin K antagonists, also called coumarins, are used in a variety of clinical settings. Their use is challenging because their therapeutic range is narrow and dosing is affected by many factors, including genetic variation, drug interaction, and diet. Time spent outside the therapeutic range increases the risk of bleeding and or thromboembolic complications. Indications for vitamin K antagonists are atrial fibrillation, acute coronary syndrome, heart failure, prosthetic heart valve, stroke, deep venous thrombosis, pulmonary embolism, antiphospholipid syndrome. There are many advantages and disadvantages compared with the other anticoagulants, and choice of agent depends on clinical setting and patient factors. The disadvantages include higher rates of thromboembolic and bleeding complications in individuals with atrial fibrillation, requirement for frequent monitoring with associated costs and burdens. Dosing is affected by illness, changes in diet, and numerous interacting medications. Advantages include large body of clinical experience, including long-term use and clinician familiarity with use, greater efficacy than other oral anticoagulants in patients with prosthetic heart valves, low cost and wide availability, significant experience with reversing the anticoagulant effect if needed. Example for serious bleeding with vitamin K, fresh fluorescent plasma, or prothrombin complex concentrates. There is no evidence that this translates to a lower case fatality rate among patients who experience major anticoagulant associated bleeding. The following principles need to be applied before warfarin administration and are generally applicable to other vitamin K antagonists as well. Baseline testing is needed prior to starting warfarin. It is appropriate to obtain these tests such as baseline prothrombin time with international normalized ratio and baseline activated partial thromboplastin time, complete blood count including platelet count to obtain a baseline and identify thrombocytopenia, serum creatinine to estimate glomerular filtration rate, liver function tests to identify potential alteration of warfarin metabolism or hemostasis, urine or serum pregnancy tests for women of childbearing potential due to risks of teratogenicity.